Welcome to Pulse Pressors, where critical care gets crystal clear. Among the hypnotic agents used for induction, Etomidate stands apart, a drug engineered for stability. When the pressure is fragile and seconds matter, Etomidate buys control without the cardiovascular collapse that other agents invite. Etomidate's defining virtue is neutrality, minimal change in heart rate, afterload, or contractility. For patients clinging to perfusion, it's a rare drug that induces hypnosis without pulling blood pressure down. Fast on, fast off, steady in between. When the situation demands rapid unconsciousness, a crashing septic patient, a post-cardiac arrest, a trauma in extremis, Etomidate provides a controlled descent. It's the induction of choice when cardiovascular reserve is paper-thin. Etomidate's onset is nearly immediate, its exit just as quick. Redistribution into muscle and fat ends hypnosis within minutes, while metabolism clears it over hours. This makes it ideal for short procedures or single-dose induction. The trade-off for Etomidate's stability lies in its side effects. By inhibiting 11-beta hydroxylase, it halts cortisol synthesis, sometimes for up to 24 hours, a hidden liability in sepsis or adrenal insufficiency. Another hallmark is transient myoclonus, those dramatic jerking movements you often see moments after administration. They occur because cortical activity is suppressed unevenly. The inhibitory centers go quiet before the motor cortex does, leading to unopposed muscle firing. These jerks are self-limited, resolve as plasma concentration equilibrates, and are not seizures. There's no postictal state, no loss of EEG coherence, and no prolonged hypoxia. They fade within seconds to a minute as central nervous system levels stabilize. Etomidate should never run as a continuous drip. Doing so silences adrenal output and worsens outcomes. In septic shock, the stability it gives may come at the price of hormonal suppression, so balance the benefit against the loss of cortisol responsiveness. Typical RSI dosing is 0.3 milligrams per kilogram, a smooth induction within 15 seconds. Because there's no reversal, recovery depends on redistribution into other tissues. Pair it promptly with analgesia and a maintenance sedative once the airway is secure. Etomidate wears off quickly, usually within minutes, but its hormonal effects do not. After intubation, transition immediately to a continuous sedative like propofol. In critically ill or adrenal-compromised patients, consider hydrocortisone coverage. When your patient is on 3 pressors and you still need to intubate, Etomidate is the anchor. Use it once, use it cleanly, and don't repeat. Its stability buys you precious seconds of control, but repeat dosing risks prolonged adrenal silence. Etomidate's pressure curve is unmatched. Where propofol dips and ketamine surges, Etomidate stays flat. It's the only hypnotic that lets you induce a crashing patient without further collapse. But remember, it doesn't blunt pain. Etomidate is the epitome of controlled induction, swift, smooth, and cardiovascularly silent. Use it when blood pressure matters more than anything else, but remember, its calm surface hides an endocrine cost that echoes long after the hypnosis ends. This is Pulse Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.